An electronic health record is an electronic version of a patient's medical history. It is maintained by a provider over time and may include all of the key administrative clinical data relevant to that person's care under a particular provider. This can include demographics, progress notes, problems, medications, vital signs, past medical history, immunizations, laboratory data, and radiology reports. Patients can access their personal record at any time. Electronic health records can be shared among all the patient's providers, providing a continuum of care for that patient. There are regulations in place for electronic health records. All electronic health records in the United States must be HIPAA compliant. For quality of use in the United States government programs, Medicaid and Medicare, the electronic health records vendor must meet certain criteria. That is to say, they must meet meaningful use criteria. Healthcare providers that utilize electronic health records use them in ways to benefit both the provider and the patient. Electronic health records extend to patient portals and mobile health apps. Electronic health records are the next step in continued progress of healthcare that can strengthen the relationship between the provider and the patient. At any time, the patient can access their medical records. They can look at upcoming doctor's appointments. They can see medications they are taking or have taken in the past. They can verify any allergies that they need to. They can look at their insurance information. They can see any scans that they've had, CAT scans, x-rays, those kind of tests. They can do that anytime that they want to whenever they get on their patient portal. There are several target markets for electronic health records. Those would be hospitals, physicians, outpatient centers, long-term care facilities, or organizations that would benefit from this technology. The purpose of electronic health records is to improve patient care. With an electronic health record, a patient can access their medical information. If they are at a particular doctor's office, they want to see what specialists they've seen, they can do that. Let's say that they have a broke arm. If they are at their primary care physician's office, they can look up the x-rays, they can look up any treatments that they've had, and this can be helpful with insurance claims as well. Patients can share their medical record with all their providers and make sure that their information is up to date. They can see if there's prescriptions missing, maybe missing appointments that's not in their electronic health record, and they can update that as well. All providers can see what medications the patient is taking as well as current treatment plans are in place. That would be great as far as to see, like let's say if it is a pain medication or any kind of medication for treatment for like high blood pressure, diabetes, those kind of things. This collaborative effort can result in more accurate diagnosis for the patient. The patient is encouraged to be a participant in their health care instead of just a bystander. This can lead to more informed healthcare decisions. Patients that are well informed can make better healthcare decisions. Once they see the overall picture from all their providers, they can better make healthcare decisions for their future. For the provider, the electronic health record has numerous benefits. They reduce the incidence of medical errors by improving accuracy and clarity of medical records. No more handwriting that's they can't read someone's handwriting. Electronic health records make a patient's information readily available, reducing duplication of tests and reducing delays in treatments. Electronic health records can reduce provider overload as they improve productivity and reduce the time spent with patients. There is a reduced cost with the use of electronic health records through decreased paperwork, improved safety, reduced duplication of testing, and improved patient health. Electronic health records can decrease physician burnout. Electronic health records can be successfully implemented in several healthcare settings. With the proper usage, they can benefit both patient and provider.